calm down. If you feel uncomfortable at all, just let me know, okay? So first thing we're going to do is we're going to start out with inspection of the thoracic cage. And when we inspect, we want to inspect the posterior aspect, the lateral aspect, looking for size, shape, symmetry, configuration of the thoracic cage, looking for any type of skin lesions, congenital anomalies. Okay, do you mind if I pull this down? No. Okay. Looking for any abnormal pulsations, abnormal breathing patterns. Next we're going to do is we're going to go through some palpation. If I feel anything tender, just let me know. So we're going to start first with just general palpation. And excuse me, my hands are cold. Any tenderness at all there? Anything there? Anything there? Nope. And notice as I'm palpating, I'm not invading the patient's personal space, feeling his chest or anything like that. Then we're going to do compression. I'm just going to squeeze side to side. We're going to squeeze 2 spots. Lift your arms up a little bit. Any tenderness there? Okay, and then we're going to squeeze front to back. And you can go ahead and put your hands on your chest. Just one hand on your chest. Any tenderness there? No. Okay. Next, we're going to look for respiratory excursion. We're going to see how your chest moves. So I want you to just take a deep breath in and out. Good. Breath in and out. And then we're going to do 2 spots in the back at T6 and T10. Breathe in. And one more time. Good. Okay. So, and now we're going to do palpation of the lungs. So when we do palpation of the lungs, it's something called fremitus. I want you to just cross your arms in front of you. There you go. Lean forward just a little bit. And I'm going to have you say 99.
99.
And each time I move my hand, say 99. Okay.
99, 99, 99, 99, 99, 99, 99.
Okay, good. Now we're going to do it on the lateral aspects. And just go ahead and lift your arms up.
99, 99, 99.
Okay, and then we're going to do arms down. Relax your arms. Say 99 again.
99, 99.
Okay, good. And then we're going to do the breath. Mind if I pull this down?
99, 99, 99, 99, 99, 99.
Okay. And now we're going to palpate for the heart. And the points that we're going to palpate for are the aortic. So we're going to first find the jugular notch, sternal angle, come down second intercostal space, and feeling for the palpable portion of a murmur. So there's aortic, pulmonic, herbs, ectopic, tricuspid, mitral, and then for the gastric. Okay, so that's percussion, or that's palpation of the heart. Next, we're going to do percussion. So I want you to cross your arms in front of you, and we're going forward again. And this time, as I percuss, just let me know if you feel any tenderness. Lean forward a little bit. There you go. Good. And now we're going to do the lateral aspects. So just raise your arm. There we go. Just hold it over like that. Now Now, if the patient happens to be real wide, you may want to do a couple strips down the side. The thinner they are, the less tissue. Okay. And we're going to do the other side. Okay. So that's percussion of the heart, of the lungs. Now we're going to do percussion of the heart. And we're going to do it the third, the fourth, and the fifth intercostal spaces. And again, the thicker the patient, the more spots that you're going to percuss. Okay, and down. So that's inspection, that's palpation, that's percussion. Now we're going to start doing some auscultation. And so I'm just going to listen to your lungs. First, I want you to take a deep breath in and out through your mouth. Okay? If you feel like you're going to get dizzy, let me know. Cross your arms in front of you. There you go. Lean forward a little bit. Breathe in. One more. Sorry. Go ahead, breathe in. Good. Okay, lift your arms up. Breathe in. Breathe in. Good. Arms down. You doing okay? Mm-hmm. Breathe in.
Jesus to the valve.
Okay. We also have some diagnostic tests to do. So the first one is echophony. I want you to take, just say E. E. Longer. E. Good. And again. E. Good. Now I want you to whisper 1, 2, 3. Good. And again. And now I want you to say 1, 2, 3.
1, 2, 3.
And again.
1, 2, 3.
Okay. Check, check. Next, what we're going to do is we're going to listen to your heart. So what I'm going to have you do is I'm going to have you lie down. So just stand up for a second. I'm just going to lie this down so you don't have to lie in the cold weather. Just go ahead and lie flat on your back. Just go ahead and bend your knees. And when I lie the patient down, I always have them bend their knees first because during the abdominal exam, knees need to be bent. Okay, it's much more comfortable for the patient, especially those patients that have had back pain. So what we're going to do is we're going to gown them first, so because we're going to eventually have to bring the gown out. So I'm going to listen to the heart first. Grab me a stool. If I pull this down? So the first one we're going to listen to is the aortic point. you mind if I pull this up? And then we got the mitral. And then we're going to use the bell for those same points.